Hey guys, hope you're having a good week. Sorry we haven't done these videos for a little bit. I noticed how gray my hair's been getting and I didn't want to see myself on camera, so I admittedly stopped doing them. Just kidding. So I appreciate y'all watching the video today, and if you're tuning in, you're probably doing that because the email I sent was way too long, and I do apologize, but I'm very excited to talk about a couple things today. One of the things is I was here a couple days ago. I had to bring my daughter in my office to pick something up, and she asked me, what do I do here every day? And admittedly, I kind of struggled to answer that question to an 8-year-old who thinks that the ETSU president and the president of the United States are not the same person, and why would you have two presidents? So explaining her how hospitals run was kind of tough, but she had some questions and I answered them, and she knew that my parents were both in healthcare and in medicine and nursing, and she remembers my dad being here at the hospital a couple years ago and being sick, and she said this and it made me tear up. She said, "So you get to help people like Poppy so they can go home and play with their kids." And I broke down in tears when she said that. All of us come here for a reason, and some of us because we had family members who were sick and we took care of them, or maybe you just have a deep conviction to help people, or you yourself were a patient and had a medical error or something happened to you, or someone treated you well and you wanted to pass that along. We all come here for a reason. We get the question a lot, where's the light? When's going to get better? We've been through a lot over the past couple of years, and that's a really hard question to answer because there's not one thing that we can do that can fix a lot of the things that we have going on that aren't just unique to JCMC and Ballad, but are things that a lot of us struggle with. But I believe that it's not one thing that we can do, but it's a summation of a lot of different things and a team that works together on every little task. And no task is too small and no decision too small or insignificant that can get us on the right path. And I'm here to tell you today that I do see some light. I'm very excited and encouraged by it. I think it's a lot of the hard work that you have done, that our team has done, that our leaders have done to try to get us on the best path that we can be, because we have a responsibility to do that as the region's only level 1 trauma center and the place in Ballad Health that the sickest patients come to. A couple things. One is this month marks 11 straight months that we've had declining team member turnover. So less people are now have been leaving this facility every single month than they did before that. Specifically for the reduction, we've seen about a 30% decline in turnover for overall team members, and then a 35% reduction in nursing turnover. And on top of that, we're actually seeing more people transfer into JCMC than are transferring out to JCMC at a rate of about 3 times, which we've not seen in a long time, or since I can remember. There's other things. We have our infection rates that are down in some categories 50% for the top 3 infections that we have: C. diff, CLABSI, and CAUTI. Our patient experience scores, I got these today, comparing our first quarter of the year to last year, and every single is up. Nursing communication is up 20 percentile points. You've got responsiveness of staff that's up 23 percentile points, and then overall communication about medications is up 40 percentile points. On top of that, you've got the metrics that we report to the board and to the state for quality. Those key target metrics, 10 of those 18 are better than last year, and 8 or 6 of them are in the top 90th percentile, and that's work that you guys are doing every single day for our patients. It's not time to rest. It's not time to just sit back and say, hey, the data looks good. It's time to rally, and your leadership team is fully engaged and supported to do that. So there's a few things that we are doing. The town halls that we were doing before, we're actually going to make those department level listening sessions. So we'll be doing those every 6 months in every single department. We'll do day and night shift. We'll be coming to the departments to talk specifically to the team members in those areas to talk about the issues that you're facing, and then we can really dive into those with you and try to fix them, things that are important to your area. We're investing a lot of dollars into things that directly impact the front line. I've talked to the other town halls about that, but the things like recliners for patients, IV poles, we're replacing a whole fleet of IV poles. You've got bedside tables, you've got mat cart batteries. We heard about that for years. We replaced all of the mat cart batteries that were dying. In the ER, we've purchased a new stretcher fleet for the ER, bedside tables, EKGs. We have a new PET scanner that's going in. We have a new cath lab that's going in. And a lot of this is catching up. even during COVID where we weren't spending the dollars that we didn't have. So we heard a lot of the things that you said, and we're paying attention to those issues. So if you have things in your that need to be addressed, please escalate those to your manager so they can get on our radar. We started the team member frontline education committee, focused on making sure that our team has the tools that they need to do and they have opportunities on campus that they can learn and grow in their field and feel competent and confident when they're taking care of or supporting patient care. That's been the Friday grand rounds that you've seen. We've done one. We have the second one coming up this Friday. And then we've been doing some leadership grand rounds where we're bringing speakers every month to coach our leaders and give them some tools that they don't always want to hear from the executive team on. And then that's going to morph into orientation and how do we beef up orientation on campus to make sure that there's cross departments orienting with each other. And I heard a lot about nurses rotating with therapy and PT and wound care. So a lot of that is going to start coming your way here very shortly. We've been investing a lot in student onboarding and making sure that their experience here is great as it should be, is we treat them like team members because they are our future team members. And we have a significant responsibility here as at JCMC as the largest teaching hospital in Ballard to provide an environment that people want to learn in, that people feel, we were all students at one point, where people can come and feel like we care about them and that they can become the best version of they can of in their career. And that's something that we can help them do. So you've probably heard some of the things over the intercom of Be Seen and for nursing. We're going to expand that. We've been meeting with a lot of the different programs about how we can engage those students. And ultimately, hopefully they choose to come work here because of that. The last thing I want to talk about, and I'll be talking more about and giving more information soon, is around safety, specifically around your safety and making sure that that it is never okay that our team gets harmed by either a patient or a visitor. Unfortunately, we do have incidents of that, and there was an article not long ago from I think it was Becker's, that talked about how frequently a healthcare worker gets injured or is subject to workplace violence. That's never okay. It's never okay. So the things that we'll be bringing forward are intended to make positive change in that, and to make sure that that we have your back, that those events should never happen and we won't tolerate them. That's all I have for today. I want to end with this. I do believe this is some light, and I know that this is a tough time of year for folks with the holidays coming up and vacations, and people are tired. But the question of where is the light, y'all? This is the light. This is the glimmer of light that we've been looking for. And are we declaring victory? No, we're not. This is the time where we need to rally and really get behind our frontline team and do the things that are important to you, for you, so you can take care or support the patient care the best that you can and go home every night that you did a good job and enjoy time with your family and have that. So I appreciate everything every one of you do. And please, if you need anything ever, you know where to find us. We're out and about too, so please pull us aside. And that's all we have for this week. So thank you for tuning in, and have a great day. Thanks.